Welcome to Respiratory Motion's Setting Up the ExSpiron in Basic Monitoring. Remember, the ExSpiron has three modes of patient monitoring to choose from. Basic monitoring is generally used for adult non-ventilated patients and is the most widely used mode of patient monitoring. Basic monitoring is not available for pediatric patients below 35 kilograms in weight. Volume sync is used for adult and pediatric patients that start out on a ventilator in the ICU or operating room and will be monitored with the ExSpiron after extubation, especially those with bilateral asymmetry. Percent baseline is used for pediatric cases below 35 kilograms who did not start their monitoring while on a ventilator. Our focus today is basic monitoring. Before starting with the ExSpiron minute ventilation monitor setup, let's discuss proper placement of the disposable pad set, as it is key to the function of the ExSpiron minute ventilation monitoring system. The application of the pad set is meant for clean, dry, and intact skin. Routine skin prep using alcohol or other skin prep solution is recommended prior to placing the pad set on the patient. It is also recommended that if a patient would require shaving or clipping for EKG electrodes, you follow your facility policy and perform this accordingly. For easy placement, there are three anatomic landmarks: A, the sternal notch, B, the xiphoid, and C, the mid-axillary line at the level of the xiphoid. The pad set is designed to help placement on the right side of the patient's chest at a 90-degree angle. Start by locating the patient's sternal notch. Place the pad set labeled head 1 centimeter below the top of the bone in the sternal notch. Next, move south in a straight line, letting the desired length of the pad set strip pull out of the pouch to meet the patient's xiphoid process. The smaller round pad should be placed here. And lastly, moving 90 degrees from the level of the xiphoid, again, letting the desired length pull out of the pouch, allowing you to reach the patient's mid-axillary line. The middle of the pad set labeled side should be placed here. After the pad set has been placed on the patient, connect the tail of the pad set, which has a black connector, to the white patient cable coming from the ExSpiron monitor. You can affix the clip, which is located on the white patient cable, to the patient gown to assist in preventing any added tension to the cable or the pad set. Setting up the ExSpiron minute ventilation monitoring system is quite simple. To get started, the power button is located on the left-hand side of the monitor. All you need is one single yet firm push of the black button. The ExSpiron will turn on. This may take up to 30 seconds. You know you're ready to start initiating the actual setup process when you see this home screen. To get started, simply touch Select Patient. You can use either your finger or the stylus, which can be found on the right side of the ExSpiron monitor. When you reach this point of the setup, you have two options. You can choose to monitor a new patient, or you can find and select a patient who had been previously monitored on the ExSpiron and disconnected for a test, a shower, or a variety of treatment reasons. We're going to first focus on entering patient information for a new patient. To get started, touch the new patient icon, which is located on the top right side of the screen. When entering information for a new patient, you are required to enter three key pieces of demographics: height, weight, and birth gender of the patient. They are all highlighted here in red. It is also highly recommended that you follow specific facility policy with regards to the use of patient name and/or medical record number. You also have the choice to select either adult or pediatric mode of monitoring. Please note, if you select pediatrics, you will not be able to continue with basic monitoring, as it is only for use on adult patients at this time. The second option is to start monitoring a patient who has been monitored in the past 7 days on the ExSpiron minute ventilation monitoring system. To restart monitoring one of these patients, you simply locate the patient from the list in the box on the left of the screen and make sure that the patient is highlighted in blue you wish to restart. You can verify the patient information entered is correct and touch the Confirm button in the lower right corner of the screen. The white patient cable can be connected at any time during the setup process. If for some reason you have not yet connected the pad set tail to the white patient cable of the ExSpiron, you should do so now. Once properly connected, you should visualize a respiratory trace in the upper window of the main screen. It is simply showing you connectivity to the patient. This window is a 30-second respiratory trace window and does not require interpretation of a waveform. It simply shows that you are connected properly. These are 2 examples of what a poor trace might look like. Do not proceed with monitoring the patient until you can visualize a good trace in this window. If you happen to see a poor trace, the first thing to do is simply be patient and watch the screen to see if you visualize an error message. An error message such as check pad set or signal interference requires immediate attention. You should start by first checking that the pad set has been applied properly and has good contact with the patient's skin. Ensure the pad set is connected to the white patient cable and verify the cable is clear and free from other hospital equipment. If you need to reposition the pad set or think there is any problem related to the pad set, you must use a new one. Trying to move a pad set or trying to tape it down may lead to problems later in the use of the ExSpiron. You should just replace the pad set now. That quickly, you are now ready to begin your patient monitoring. First, you must choose the appropriate monitoring mode. As mentioned earlier, our focus in this module is on basic monitoring mode. Basic monitoring can be used for any adult patient in any care area where you want to evaluate and monitor respiratory status. Basic monitoring is our most widely used mode of monitoring minute ventilation for non-intubated patients. It is ready to go right away and can be placed on any patient, anytime, anywhere, no matter what the respiratory status might be. Begin by selecting Start Basic Monitoring button from the taskbar on the right. This default alarm screen will be displayed while the ExSpiron is calculating patient metrics in the background. Alarm settings can be customized as needed, but most likely you will accept the current alarm settings by pressing OK. After confirming the alarm settings, the calculating metrics screen may still be visible. In approximately 30 seconds, it will disappear, and the ExSpiron monitor will begin displaying all of the patient's minute ventilation data. Managing patients on the ExSpiron monitor is simple. The displayed color graph makes it easy for clinicians to recognize subtle changes in a patient's real-time respiratory status and track the minute ventilation trend. In basic monitoring mode, minute ventilation is displayed in liters per minute, along with a percent predicted minute ventilation, which is calculated from the patient's body surface area. Percent predicted minute ventilation and its trend to the right are what you need to focus on for your clinical practice. Based on your clinical need, You can change the display by pressing Settings to allow you to view the patient-trended segments ranging from 15 minutes to 12 hours. Minute ventilation percent predicted is unique to the ExSpiron monitor. The ExSpiron corrects for patient size and provides a percent number for any given patient, where 100% would be normal for that patient size, breathing normally at home while resting. It is shown on the graph in a white line. It happens to be highlighted here for visualization purposes in red. The darker shaded area of the graph is representing values below 40% of predicted minute ventilation. When a patient's values are below 40%, it is indicating they are having hypoventilation moments. If the patient's minute ventilation percent predicted remains below 40% for a sustained amount of time, this will trigger an alarm. A low minute ventilation alarm indicating inadequate breathing or hypoventilation requires patient assessment. The yellow shaded area on the graph is representing values between 40 and 80% of predicted minute ventilation. Patients residing in this area are showing signs of reduced respiration, but are presumed not to have true hypoventilation moments and are presumed to be safe. These patients should be observed closely before and after sedative or opioid administration. During procedural sedation, maintaining a patient in the yellow zone helps optimize dosing of opioids and sedatives. Post-operatively, patients often remain in this zone due to effects of anesthesia or pain management. It should make you think of caution, but not concern. The ExSpiron monitoring system provides early, actionable, and real alarms. There are very few false alarm rates when using the ExSpiron. When an alarm is triggered, measurement values will change color and an audible alarm will sound. The alarm condition will also be highlighted in a message bar along the top of the screen. In this case, it is because the minute ventilation percent predicted was below 40% for a sustained period of time, creating a minute ventilation low alarm. If your ExSpiron connects to the Philips monitoring system, the Philips monitor will also alarm locally and in a. When an alarm occurs, you should assess your patient and follow your hospital escalation protocol. You may pause alarms for 2 minutes by pressing the Pause Alarm button during your assessment and management of the patient. The alarm will stop once a patient resumes adequate ventilation. Remember, if the patient's minute ventilation percent predicted is between 40 and 80%, the ExSpiron will not alarm, as this is a caution zone. You should always remember to look at the monitor when you want to assess your patient's respiratory status, such as prior to administering pain or sedating medications, as your protocol may call for an adjusted dose, an alternative medication, and other measures. To pause the ExSpiron monitoring for patient toileting, patient hygiene, or other treatment reasons, or to end the patient session altogether, touch the End Monitoring button located on the right side of the screen and select Yes. You have now paused your current monitoring session. If you are completely through with monitoring this patient, you may also touch the button that says Close Patient and power off the ExSpiron. If you intend to reconnect the patient upon their return, simply reconnect the white patient cable to the tail of the pad set and begin patient monitoring again. Monitoring with the ExSpiron Minute Ventilation Monitoring System is really that simple. You can rest assured that while you are managing your other patients during your busy day, the ExSpiron will be there to silently monitor your patient's respiratory status and alert you at the start of respiratory decline. It allows you to take early action and avoid the need to rescue. Never miss a breath when using the ExSpiron Minute Ventilation Monitoring System from Respiratory Motion. For additional information, please visit our website at www.respiratorymotion.com.